Hi, did you do extraction recently? I am Dr. Happy. I am sharing some important instructions to be taken care after extraction. After extraction, you have to keep the gas piece tightly in the extraction socket for 30 minutes. After 30 minutes, you can change the gas piece and you have to bite tightly for another 30 minutes. After 1 hour, if you still feel bleeding, you can replace it until you notice the blood is clotting. The main goal of this is to avoid the dry socket, that is a complication of the post extraction, and here actually it leads to dislodgement of the clot and leads to infection. Avoid spitting frequently. Avoid gargling with your mouth vigorously in the first 24 hours. Avoid chewing tobacco or avoid smoking in the first 24 hours. Avoid using the straw while drinking juice or water. That will lead to dislodgement of the clot and lead to infection. Do not touch with the hand or tongue at the extraction socket. It's natural to feel some discomfort at the extraction site, but do not touch with tongue or hand at the extraction site. You can gargle your mouth with salt water after 24 hours for 5 to 6 days. And the dentist may prescribe you some antibiotics or analgesics for your pain. Even if you don't feel any symptoms, you have to take the medication as prescribed, as directed by the dentist. The dentist may place some switcher after extraction, and if it is resorbable, it may go by itself within a week. If it is non-resorbable, the dentist may schedule for you an follow-up appointment to remove the switcher. You can keep some ice packs at the extraction site for the first 24 hours. This will cause constriction of the blood vessels and reduce the bleeding as well as the inflammation. And you can keep the ice packs at 10 minutes interval, and after 24 hours you can keep some hot packs, because after 24 hours, even if you keep the ice packs, there is no use. And you can gargle your mouth with lukewarm water with salt after 24 hours, and do not rinse your mouth in the first 24 hours. And regarding the diet, you can eat some soft diets in the first 24 hours. Avoid hot foods and drinks. You can eat foods that do not cause excessive strain on your mouth, that requires excessive chewing. You can eat some scrambled egg, rice, yogurt, soups and juices. And avoid drinking and eating hot foods. The cold foods is much more preferred. And avoid doing heavy exercises, and do not strain your mouth with excessive mouth opening and excessive strains on your mouth. That will cause excessive bleeding. So follow all these instructions, and avoid the brushing near to the extraction site in the first 24 hours, because that will also can cause dislodgement of the clot as well as bleeding from the extraction site. So even if a mild bleeding that mixed with saliva, it's natural, do not worry. I hope this video is useful. So follow these instructions and avoid the post-extraction complications like dry socket and infection, and make your wound heal faster. I hope this is very useful for you. Please like, share and subscribe. Thank you.